Hey there, Dr. Erickson, EHS Physical Therapy, Chiropractic. I want to talk about an uncommonly used technique for a common problem. So we often get, and you may be watching this looking for solutions to the pain that you're having from the neck, kind of into the shoulder blade, back into here, and down the arm. So I always like to start in sitting with just normal, cervical, lower cervical, upper thoracic movements. Probably something like a, retraction extension, maybe a side bend. There's different things to do in that load. Now, if you can do those and you've reached to a certain point where you've kind of plateaued and I can't get any further beyond that, the next place I'd go would be a prone, sustained retraction extension. So I'll show you what that means. It's a little bit more forceful in that lower cervical spine. So oftentimes we use this to either tease out and see how far someone has come, how far they've progressed thus far, and if they can tolerate that, then we know we can move more force and further into the process. If this position bothers them and it sends pain back down the arm, it doesn't mean that it's necessarily wrong or that we've taken a step back or aggravated something. It just means they're not ready for that level of load. So it's a good testing procedure, but it's also a good reduction position and move if you can tolerate it and you're like, oh yeah, afterwards that really felt good. I haven't found a lot of good videos or explanation for it on YouTube yet, so let me show you what I mean. So you have to start lying down, face down, and then you're going to put pressure through your forearms and elbows. So in this pressure, I want you to be aware of what's going on in the upper back, in the arm. To use this one right now, I would suggest that you do not currently have arm symptoms. Probably just pain in the lower neck or in that shoulder blade area, okay? So just like you would do in the chair, you probably would start it at some point where you'd use that retraction. So I want you to do that. That's the first step. So retract back first in neutral, then roll back into extension, and then you've got to put your fingertips under your chin. But look, from here, I don't have enough length. So once you get here, then walk your elbows forward, then put the fingertips under the chin, and then watch my upper back. You should breathe out and sustain it. Hold it there. Let that upper back fall. And you can hear it in my voice. It's got to be slightly uncomfortable. It's got to be so far back there that it's hard to breathe and slightly uncomfortable. So hold it for 35, 40 seconds, and then come out of it and just reassess. Retest. In this case, I'm going to retest my right arm and see, did it produce pain back into the arm? Or after I'm done, do I now have improved, overall improved motion and improved cervical symptoms and motion? So you always got to test and then retest those symptoms that you have. So if before I had a little bit of pain rotating right, a little bit of pain coming backwards, I do the retraction extension, I sustain it for 35, 45 seconds, and then that's improved. That's a green light to do a few more of those. And we want to do 2 or 3 times of that and start to increase the time that you're down there. 35 seconds, 45 seconds, a minute. You don't need to do very many of them, just maybe 3 repetitions, but hold it for longer, okay? So that's the prone meaning on your stomach, sustained retraction extension, and that's a really good exercise to finish off that last little bit of a disc injury in the lower neck that it's like, man, it's 85, 95% better. There's just something still there that's kind of blocking me. Go there and try that a couple times. That might kick it just over the edge so everything is completely gone. Thanks.